So, when psychiatric patients visit their mental health provider, they might undergo a mental status examination. This is basically a way to assess and record various aspects of their mental well-being. It helps evaluate their physical presentation, memory, thinking ability, orientation, emotions, and general behavior. The examination is particularly useful for patients dealing with various issues, such as anxiety, depression, delusions, hallucinations, or mental decline. The mental status examination results depend on the careful observation and judgment of a qualified mental health provider. These findings serve as one of the foundations for diagnosing the patient's mental health condition. By the way, we'll also show you an example of how all this information could be written in paragraph form at the end of this video. So, let's get started. During your mental status examination, your mental health provider will evaluate your physical appearance to see if you are tidy, appropriately dressed for the situation and surroundings, displaying any inappropriate behaviors, maintaining good personal hygiene, or being well-groomed. They will then observe your speech patterns to assess whether your tone is normal, fast-paced, pressured, low, lacking expression, monotone, soft-spoken, or loud. They will also examine your eye contact to determine if it is within or normal range, avoiding or intense. Additionally, they will analyze your body movements to see if you exhibit signs of restlessness, sudden and repetitive movements, or slowness. Subsequently, they will assess your mood to identify if you are experiencing anxiety, depression, irritability, exaggerated emotions, tearfulness, emotional reactivity, or rapid mood swings. Your thought process will be examined, including orientation and memory abilities, the coherence of your goal-directed thoughts, level of attentiveness, and whether your thought processes are organized and logical. They will explore the presence of hallucinations, typically visual or auditory, such as seeing things or hearing voices. Furthermore, they will investigate if you exhibit paranoia or irrational suspicions, hold delusions or false beliefs, and have thoughts of self-harm or harm towards others, as well as your intent to act upon those thoughts. Your behavior will be assessed for calmness, cooperation, aggression, hyperactivity, withdrawal, guardedness, unusual behaviors, or repetitive patterns. Lastly, your mental health provider will evaluate your ability to provide accurate information and exercise sound judgment. Let's take a look at an example of a mental status examination involving an adult male who was experiencing symptoms of anxiety. Here's how it would be documented in a narrative form. So, we have Mark here. He seemed well-groomed and appropriately dressed for the day and the occasion. When he spoke, his pace was mostly in the mild to moderate range, with an average volume. However, at one point, he seemed rushed or pressured in his speech. He maintained regular eye contact throughout the examination. There was some restlessness observed in his behavior, but overall, his emotional expression was full and appropriate. He reacted to the situation, and his mood appeared consistent with his anxiety. Mark demonstrated good orientation as he correctly identified himself, knew where he was, recognized the date, and understood his situation. There were no signs of memory impairment. His attention appeared normal, as he could focus and stay engaged during the examination. He denied experiencing any auditory or visual hallucinations, and he also denied having any thoughts of self-harm or harming others. There was no indication of any delusional beliefs. Mark's behavior was cooperative throughout the examination, and he actively participated. Additionally, his insight and judgment were good. And that is how a mental status examination is documented. If you find this YouTube video helpful, please consider liking and subscribing to help us reach a larger audience. Thank you, and stay tuned for more upcoming videos.